protect the country. The determination we have made is that when all is said and done, we have two problems. One, we have a pandemic that is growing exponentially in our country. It replicates, in the way it grows. That's the way pandemics behave. 1 person, 2, 4, 8. We've talked about that. And that's a problem. That's a problem in itself, because what it does is it really overwhelms even our minds. I could give you a simple test that I've been giving a number of people. If I gave you a choice between a very interesting 1 cent that actually multiplies every morning, it doubles every morning, and I give it to you for 31 days, and I say to you, you have this 1 cent, 31 days, every morning you wake up, it will be 1 today, tomorrow it's 2, the next day it's 4, the next day it's 8, and then 16, and so on and so forth, for 31 days. I give you a choice between that 1 cent for 31 days and 1 maluti, 1 million maluti today. Which one are you going to choose?
1 maluti. 1 million maluti.
1 million maluti, right? Your response is exactly how many people respond. Give me my million. 1 cent, doubling every day. Really, you're joking. But guess what? Here's a shock. In 31 days, because of the doubling every day, that 1 cent will be worth 10 million maluti. I'm telling you. Take it brute force. 1, 2, 3, 4, 5, 6, 31 on a piece of paper. 1 cent, 2 cents, 4 cents, 16 cents, 32 cents. Do it. You'll see what's going to happen. A pandemic behaves exactly like that in a population. It doubles like that, especially if we are not taking control measures. Which means really, we are looking at a very big fundamental problem that shocks us when it happens. Currently, we also have another problem that goes together with the fact that the pandemic grows exponentially. The other side of the coin is the fact that we then do not have healthcare capacity. Our healthcare system, the healthcare facilities, the hospitals, the clinics, together with the doctors and nurses, is very weak. Very weak. We've been saying many a time that in this country we have really, effectively, only 2 ICU beds. We have 10 at Queen Mamohato Hospital, but we've been advised lately, stop counting them because they are not available, because they are there for your typical complications, accident victims, complications at birth, and other sick people who need those because they're at Mamohato. And in any case, if you use this ICU facility for normal patients, you can't mix them with COVID-19 patients. So the moment you put one COVID-19 patient, you have to then say everybody else can't use them. So let's not count those 10 beds. There are only 2 recently bought by Standard Lesotho Bank and sitting at Maluti Hospital. 2. Now, take the 2 elements. A pandemic that grows exponentially, a healthcare system that's bankrupt. Combine them, you end up with a recipe for disaster. What's the disaster? People dying not because of natural causes. They die because they show up at a hospital, they can't breathe, there is no ICU facility, a respirator, that would otherwise have, in fact, made them leave. Maybe in a matter of 2 hours, all you needed was connection to that respirators. In 2 hours, you would be fine. But it's not there. So what happens? They die. That's a recipe for disaster when you combine the 2 things. And these people arrive at the healthcare facilities in that replicating exponential growth. Remember the 1 cent I told you about. Now imagine that. 2 beds, 2 people take them, they're taken. Then that person arrives,
4,
they die.
8,
16, yeah.
32.
There you go. That is the cause of the problem. So we say what this country is facing very uniquely is the fact that we are going to see needless deaths. Needless because had the bed been there, these people would not have died. Now, let's admit one thing. There will be people who will die even with the best ICU bed facility, the best doctor, the best nurse in the best environment. They will still die because that's nature. You can say that's God doing his job. So we are not saying you give a bed, you save every life. No, this pandemic is here. It's going to kill people, unfortunately, and that's why we are all scared. However, what we want to prevent is people dying needlessly. We could have prevented that death by doing what? Buying the ICU bed, providing the PPE to the nurse and the doctor so that they also don't get exposed. That is the nub of the strategy that we have recommended, and it's been approved by government. It says we therefore need to move fast and do what? Two things in terms of now the how, because all that I've been saying is diagnosing what the problem is. The how is, let us now move forward and do two things. Flatten the curve of infections, and also raise the line of resources. You can call it our strategy, loosely speaking. That is the strategy now. Flatten the curve of infections. What do we mean? What you want to do is reduce the number of people arriving there.